Do you have ankle and knee pain? Are you ready to get rid of it? I'm Dr. Jimerson, a soft tissue-based chiropractor that has treated and resolved thousands of knee and ankle pain cases in the past 20 years when nothing else would help. And here's how you can do the same thing in record time, even if you've tried everything else. Now, first things first, anytime you're dealing with any type of chronic pain or injury in the body, you need to do one thing, and that's to take a step back and look at the entire biomechanical picture. Where you have pain is often not actually what caused the pain. This is one of the biggest things that I see, is that people don't really reverse engineer why they got injured in the first place or why their body can't resolve the injury. And one concept I want you to be aware of is something that's called the joint by joint approach. Now, when one joint is lacking mobility or motion, the joint next to it is going to lose stability. It's going to move too much because that motion has to come from somewhere. Now, the ankles love to have mobility or movement, and your knees prefer to have stability. Your hips, mobility. Your lumbar spine or your lower back, stability. And so the lower back is surrounded by this whole corset of core muscles, and all it wants is to have this 360-degree support. Your spine wants to feel protected. Your thoracic spine craves mobility, and so on and so forth. Everything alternates mobility and stability, meaning that when your ankles are tight, it's going to put extra pressure on your knees, extra pressure on your plantar fascia and your toes. Something is going to have to overcompensate somewhere. What I want you to try to do is look and see where your worst imbalances are across your body and try to go after those. Now, one of the reasons why our ankles become tight and don't move like they should is because we don't actually use them like we should use them. So everything in life is use it or lose it. Your knee should be able to push past your ankle in a squatting position, and you see little kids do this all the time. Some cultures continue to do this throughout our entire lives. When I was in China, you'd see 80-year-olds, 90-year-olds sitting by the side of the road reading a newspaper and sitting in this ass to grass position where their knees pass by their ankles. And many cultures go to the bathroom that way too, because their toilets are more of little porcelain holes in the ground as opposed to our Western style toilets. So again, if we don't use it, we lose it. And it's not uncommon for me to have young kids, 7, 8, 9-year-olds try to come in, and I'll have them squat deeply and they will fall over because they have tight ankles, because our resting positions are typically more sitting in a couch or a chair for most of our lives. Now, many experts will tell you not to squat deeply or not to let the knee pass in front of the ankle or the toes. And if you think about it, that just doesn't make any sense. Try going up a flight of stairs without letting your knees pass by your ankles. Now, your first solution is to do the exact opposite of what experts tell you to do, and that is to practice flexing the knee and deep ankle mobility. What you're going to do is put your foot up on a chair or a bench. Make sure it's more stable than this. Your heel should stay flat. This is very important. Don't let the heel pop up. That kind of defeats the purpose. Now, all you're going to do is you're going to push the knee past your ankle as far as you can go without causing pain. And do it for reps, do it for a stretch, do it practicing the motion, but the most important thing is to do lots of little microsets throughout the day. 5 minutes, 3 times a week is not going to cut it. It's going to take years. Think about it. You want to do a little bit all throughout the day. So do things like multitask. You can wash the dishes and put your foot up on a chair and practice. But practice this motion all throughout the day and make sure that you're listening to your body to make sure that you're not rushing the tissue or the muscles. Again, you don't want to feel pain. You can also use this method to scan all the muscles around the hip joint. Throw your leg up on something, make sure that you are holding on to something stable in case you fall. If I've got my leg in this position, it'll stretch more towards the groin muscles. But remember, joints are 360 degrees, right? So I can slowly start to turn my pelvis this direction, right? Now we're getting a stretch more into the groin muscles. If I continue tilting my pelvis down and keeping my body upright, it's going to kind of stretch more front groin. You can keep kind of rotating and kind of scanning all around the hip to see where that stuff is tight and where it could be affecting your knee and your ankle joints. Yes, there are a million different knee exercises that you can do, but my suggestion would be to find 2 or 3 different imbalances to work on, focus on your worst imbalances, and do tiny little amounts all throughout the day. I hope this helps. Make sure you comment below if you have any questions, and be sure to like and follow for more tips.